Welcome back to The Gum Guru, the podcast where we talk about all things gums, implants, and oral health, from everyday care to the issues that most people never think about. I'm your host, Lisa Bruff, and today's episode is especially important. We're talking about a population that is often overlooked, nursing home residents, our grandparents, parents, or neighbors who live in long-term care facilities. Oral health is a critical part of their overall well-being, but too often it's neglected. Gum disease, untreated decay, infections, all of these can have serious consequences for people who are already vulnerable. Today we're joined by Dr. Macon Singletary, who has extensive experience treating these patients and advocating for better oral health care in nursing homes. We'll discuss the challenges, the solutions, and how we can all play a part in protecting the health of some of our most forgotten patients. Dr. Singletary, this is a really important issue, and I know that you here at North Raleigh Periodontics and Implant Center are always concerned about the community, and this is another way, sort of a outreach into the community for you. Let's just start with the basics on this. Why is oral health so critical for nursing home residents?
So usually individuals in nursing homes are there for a particular reason. They aren't able to take care of themselves. They need help. And so it stands to reason that there may be so many other things that are going on that the oral health is neglected. And it's unfortunate because educating certified nurses, the people who are in these long-term care facilities or patients who are debilitated, educating them on what's going on orally is important. This neglect can lead to aspiration pneumonia and infection that they aspirate the plaque that's in their mouth, and it increases their demise, or their morbidity goes up. And so it's an easy thing to do. It's just a matter of making people aware of what can you do and how do you do it?
Yeah, we could have more education, I think, in some of these facilities, because I had experiences when my husband had dementia. I was in one of these facilities where they just really didn't want to do the care. It was difficult to bring in dentists or anything that would do the cleanings. And I think we finally came up with just using some gauze to at least get the food and stuff off the teeth. But I think it isn't discussed enough because some of these patients can't speak for themselves, and they may have pain and other things that are going on. Many people assume that aging alone causes tooth loss or gum problems, but that's not the full story. What are the common causes of poor oral health in nursing homes, and why is it often overlooked?
Well, it's there are other things that are happening. They're in a rehab for a surgical procedure, and they're having a hip replacement. They can't walk, and they're focusing on the major issues. And so what happens is the plaque builds up, and they may have a prosthesis that's staying in the mouth. It's not coming out, and it's fear of putting a hand in somebody's mouth I think is the issue. Educating the facility, the nurses that take care of people in these facilities, it's a simple: put gloves on, and they're concerned they may get. Some people have uncontrolled motions. They bite. They do things. They're scream and yell. I mean, there are patients that come in my office that can come. The facility brings them here, and they're out of control. And you just sort of have to you talk to them, but there's a certain way you can put your arm around them from the side, and you can start just using a brush. I mean. I would tell some of the healthcare providers or people that are coming, that are helping individuals, these nurses, I said, just get an automatic brush, battery operated on, just let them watch TV and just do it. I mean, sometimes they like doing it. It's just like they're doing something with their hands, and it's a repetitive motion. And so just an aspect of making them aware of that they need to physically remove it. They can do it themselves if they can use their hands. If not, they've got to have individuals or auxiliaries that can go in and they're trained to treat these people. And the hygiene program, there are facilities that hygienists can go to, or they can go to, and they don't need a supervision. They have a special license for people going into these healthcare facilities that they can go in and do hygiene work and help these patients. But even an individual themselves, if they have a device, a prosthesis, a denture, and they're not taking it out, that's not good. And sometimes it's difficult to remove it, and they just get some gloves on and just help the patient. They may be fighting them, but you got to be trained, to be aware of that and not be afraid.
Not to be afraid of the patient. I think that often happens. And I think sometimes, they're overwhelmed with other responsibilities and just trying to maintain those. But what kinds of treatments or preventative care can truly make a difference for nursing home residents? Are there simple strategies that can help prevent serious complications? Yeah.
Well, of course, it was talking about aspiration, pneumonia, and, COPD. You don't want that bacteria to get aspirated. So what can be done, easily? Well, saltwater rinses.
Saltwater rinses. I was thinking because we talked about that.
Yeah, 2 teaspoons of salt, 8-ounce glass of water. I mean, generally an individual can take and swish it, and if they swallow it, okay, maybe they're getting some sodium that they don't need, a sodium load. But yeah, I mean, saltwater rinses are a good thing to do. The xylitol gum or tablets.
Yeah, I was wondering about the xylitol gum or the tablets and stuff. So if they can't chew gum or whatever for reasons, but maybe the tablets, just chewing the tablets, would that help?
Yeah.
Yeah. So would you do that 4 times a day like you do with your, with them, and then that would, or just after they eat and stuff might be a big difference. That's good to know. Yeah.
But, back to the automatic brush, I mean, there's the Oral-B, you can get a battery operated thing and even if there's a healthcare provider there, they can help. I mean, there's some individuals may fight it. It's something that they can use in the mouth and not directly. There's an extension there.
What about those floss, the water picks?
Oh yeah, floss. Yes, definitely water flossers. It's messy. I mean, but you can get them over a sink and just. And some patients like it. I know some of my patients are like, I like my water pick. I'm in the shower and I'm doing my water flosser. But in a long-term care facility, they're usually in wheelchairs.
Right.
And they can wheel them up to the sink and hook the water flosser up and use that. I mean.
And then they really don't have to get too far in there. It might be easier for them. They have to worry as much about their fingers, but it would can you put things like salt water in the water flosser?
Yep.
So then that would help too. Or you could put xylitol powder or something in there.
You could do xylitol rinses. You could put that in the water flosser.
In the water flosser, and that might be a way to do it too. Mm-hmm. Yep, because it was a serious consideration for me when my husband was ill. One of the biggest challenges is identifying issues early. How can family members or facility staff recognize warning signs that someone's oral health is declining before it becomes a crisis?
Well, malodor, bad breath, that would be a sign.
Okay.
I mean, generally that's what happens. Is certain bacteria start to grow, and they produce the metabolic byproduct is hydrogen sulfide. And so if they have bad breath, that's a big sign. And they may not have bleeding gums, but the plaque builds up. There's some individuals, and I've seen it, where they're not susceptible to the immune system reacting to the bacteria. So they may get decay, or the teeth may be hard as rocks, but they got plaque and calculus all over the place. That still gets in the bloodstream. They still aspirate it.
Right.
So even though they may not have pain, may not have bleeding, it's there. And if there's a bad breath, there are 3 reasons for bad breath: sinus, mouth, and stomach.
Wow. Now this is just kind of totally out there. Just, they sell that stuff Lumi for your skin. It's supposed to acidify the skin so that you don't smell if you put it sprayed in your armpits or whatever. It's a new type of deodorant. Is there anything that you could put in your mouth that acidifies it so bacteria doesn't grow? Because they're saying that you put it in the skin and the bacteria can't grow for like 72 hours or whatever. No, we don't have anything like that yet.
The only rinse that has lasting effect is chlorhexidine gluconate. And it stains plaque like a tea stain, but it kills bacteria and binds to the tissue and has lasting effect. And so, yeah, it's Paradex or Paragard. Paragard is alcohol-free chlorhexidine gluconate. So, yes.
Oh, there is something like that.
Yeah.
Can they swallow it? I mean, because I would imagine that would be a concern with it. What if
if they swallow it, it's not
going to hurt you. Are there programs in place, or do you have an outreach where you go to these? Is there some sort of programs in place to educate the staffs at these homes? Or
Yeah, that's a good question. I just read the book, Dying from Dirty Teeth. Angie Stone, a registered dental hygienist, wrote the book. And her thrust is educating the certified nurses about what to do, but also have dental hygienists come in and help. So there's programs out there I'm not familiar with, other than the fact what I say to my patients or people who come in here with issues with family members. You know, when I retire, that may be something that I would like to do, is to go into healthcare facilities and help these people, because really there's nothing to be afraid of. It's just a matter of knowledge and how to treat it. You know, the thing about xylitol, it was first discovered in 1890 by a German researcher. And it was during World War II that it became popular, because in Finland, they didn't have sugar. So they had xylitol, which is a sugar substitute. And they found that people that were using xylitol had less decay and periodontal problems. So, and now it's becoming popular use. So, you know, just educating, just doing that. But as far as, you know, an oral hygiene program, that's a good question. That's something I got to research. And before this podcast, I sort of wanted to do that, but time got me caught up. But that's definitely a you know, we have individuals that retire and they go into prison ministry. You know, this is something I may like to do when I retire.
Is there something we can do, like if we have loved ones in nursing homes and so forth, what would you suggest for those of us who have loved ones in nursing homes and for us to do as we visit, or we, do our regular visitation? What kind of checks should we do, or what kind of things should we advocate for? You know, what's our homework with our...
Yeah, so good question, because you are the advocate for your family member or whoever is in the facility. You know, talking to the healthcare provider, the person that's taking care of the individual, what are you doing? You know, how are you taking care of his oral hygiene? Do you not understand, you know, that every time you chew, you have bacteria showers of bloodstream? We got to, you know, aspiration pneumonia kills people. Can we get you on board with using an automatic brush, or you doing xylitol rinses, or doing water floss, or, you know, can I help you with this? Because I think lots of times it's just like patients come in here and I ask them what causes gum disease and they can't tell me, and they've been going to the dentist for a long time. It's just education more than anything.
Yeah, great. I think it's an important topic, and I think it's one that hasn't been discussed much, and I think that it is something that we as caregivers and stuff can make an impact in. It looks like you've given us some simple ways to do that. As well, even if we're just visiting, even if we can only do it on our visits, it gives you a chance at least to get some help in there. So oral health is often invisible, but it's never unimportant, especially for our most vulnerable populations. Gum disease, infections, untreated dental issues can lead to serious complications, but with awareness and advocacy and consistent care, we can make a real difference. A huge thank you to Dr. Macon Singletary for shedding light on the oral health challenges facing nursing home residents and for sharing some practical ways to improve care. If you have a loved one in long-term care, or if you want to support advocacy for better oral health in nursing homes, reach out to North Raleigh Periodontics and Implant Center at northraleigh.com. They're experts in treating all patients, including those who often go unseen. And don't forget to follow the Gum Guru for more episodes that help you protect your gums, your smile, and your loved ones. Until next time, keep those gums healthy.